Hi everyone, welcome to today's Connect session. We're talking about lymphedema with Karen, and I'll let her introduce herself to you properly. If you'd like to see Karen, if you're, depending on what view you've got your screen on, you might want to change it to speaker view so that you see Karen a bit bigger, or you might want to leave it like it is. We will be sharing some slides as well in a minute, but I will pass you over to Karen. And also, just one thing I forgot, was if you've got questions that come up, feel free to put your hand up and ask them, or put them in the chat, and we'll be keeping an eye on that as well too. So without further ado, Karen, welcome, and thank you so much for coming today.
Oh, thank you, Emma. So yeah, I'm Karen. Karen Pidlyskyj, but don't worry about trying to say or spell my surname. That's fine. I am a Macmillan specialist physio in breast care. So today I'm going to talk to you about lymphedema, and it will probably have a breast bias just because that's my job. But what I would like everyone to sort of take away from the session is that what I'm saying, it can be transferred to swelling of any part of the body after any type of cancer. So if I'm talking about arms, you can relate that to legs and things like that. So it's just because I will go off on a breast bias because that's what I do, but bring me back if needed. And like I said, everything that I say can be utilized to the part of the body that's affected.
Excellent. Would you like me to start sharing the slides?
I would love it. Thank you.
Thank
you.
There we go. Can everyone see that? Okay. Yeah, excellent. Oh, thank you. Thanks for the thumbs up. That's awesome.
Oh, thank you. Yep, so that's me. Next slide, please. So as we said, I work at Salford Royal. I might not have mentioned that. So we're now part of the Northern Care Alliance, but I work at Salford Royal specifically. So the aim of today, if that's okay with you guys, is to sort of explain what the word lymphedema means, some risk reduction prevention information, what to do if you think that you might have lymphatic issue, and then basically some self-management stuff, because I think people are quite nervous and frightened of hearing the word, but what I would like you to take from today's session is that there's absolutely loads you can do to maximize your lymphatic drainage. Next slide, please. So as I said, I treat patients that have had treatment for breast cancer. So when we're thinking about breast cancer surgery, we're thinking about what has been done to the armpit. So either a sentinel node biopsy or an axillary sampling, which is a small number of lymph nodes surgically removed. I always talk about the sentinel nodes being like the gatekeepers of the lymphatic drainage. So often I say to people, did you have the blue dye put in, and it flows to where the lymph nodes that drain the breast. The other sometimes surgery that they will do to the armpit is called an axillary node clearance. So that's where they take all of the lymph nodes out of that armpit. But interestingly, with the clearance, some more recent research has shown us that even with a full clearance, you will still utilize and have the potential to utilize your deep lymph nodes in the armpit. So it is still worthwhile. So in years gone by, because I've done this a long time, in years gone by, we would avoid draining up into that armpit because we would think that there was nothing there to drain. But actually, some recent studies have shown that the deep lymphatics are still very useful. So it is worth utilizing them. And the other thing that can cause issues in terms of drainage is having radiotherapy. That's just gone off my screen there, Emma, is that? You're on mute. You're on mute. There we go.
Sorry about that. I think I'm going to have to share it like this because it's not. Don't
you worry. Don't you worry. I'll go off tangent. I'm doing well to stick on slides at the moment, but we both know I'll go off it too anyway. So when we're talking about a cancer diagnosis, we're talking about the what's been done to the lymphatics local to that. So obviously, when I'm talking about breast, I'm talking about the armpit. But if it was a head or neck cancer, we would be talking about the neck lymph nodes. Equally, it could be something more central in terms of the lymphatics. More in the abdomen and the groin, back of the knee. There's lots of different lymphatic points. We've got between 500 and 700 lymph nodes in our body, so there's lots and lots of them, which is always nice, I think, to hear when you've had anything done to any of them. You've got lots and lots left. In terms of risk factors of developing a lymphatic drainage issue after either breast surgery or radiation, it is about 1 in 5, but that is quite outdated research. So we thought that maybe the incidence of lymphatic drainage issues might reduce with sentinel node biopsy surgery coming in, because obviously you're taking less of the drainage away. But what we are seeing is some more breast lymphedema as a consequence of more breast conserving surgery. So yeah, it can happen. Sometimes I see people that develop issues that have had a tiny bit removed or all of it removed. I think there's a lot more factors to take into consideration than just what treatment you've had, but it obviously does play a part in terms of working out risk factors. Next slide, please. So like I said, then it's to do with the surgical removal plus or minus radiation. It affects the body's ability to drain fluid in and out of that limb or area. With breast cancer, we are looking at the breast or chest wall, the armpit, the hand or arm on that side. Sometimes people say to me, oh, I've got swelling elsewhere, maybe in my leg or my other hand. We would say that would be unlikely to be related directly to the surgery or the radiotherapy, but it could be some other kind of treatment that you're having in terms of chemotherapy or something like that might be creating a fluid drainage issue. Next slide, please. So the lymphatic system is an internal fluid drainage system. So it's how we move fluid around the body. So it runs alongside the circulatory system, but it's different in how it works. So the heart pumps blood around the body all the time, regardless as if of whatever we're doing. So we could be asleep, we could be awake, the heart will pump constantly, thankfully. But the lymphatic system is different for the fact that it needs movement to drain. So it's pressure, so it's movement of a limb, which opens up the drainage pathway to start, and then it moves along that pathway with movement, and then when it gets to nodes, they get squashed again with movement, and then they get drained. So the more we move, the more we're draining ourselves, basically. And like I said, we've got lots and lots, hundreds and hundreds and hundreds of them inside us. So although it might feel like a big thing to have surgical removal or radiotherapy of a set of the system, the body is very clever. We just have to show it how to utilize different paths. Okay, thank you. Again, thinking about the immune system, often people are not sure why we talk about the immune system when we're talking about lymphatics, but basically it's to do with that fluid transport. So inside us, when our body thinks there's an infection somewhere or recognizes that there's like an open wound, it's the lymphatic system that will go and send those infection fighters to where they need to go, and then deal with the infection and then get rid of the waste from that. So the difference between, again, the circulatory system and the lymphatic system is that the lymph system takes bigger things that won't go back into the blood. So it's things like fats, hormones, enzymes, and things like that. So in essence, that part of the body, it will struggle a little bit more to deal with infection. The bit that it would drain what those lymph nodes would be used for. So like I said, in that armpit, it would be the hand, arm, breast, chest wall on that side, which would take it a little bit longer to recognize that there would be an infection there, and then it would take a little bit longer for it to heal. So we do talk a lot about reducing the risk of infection, which is almost a prevention, because if the infection can't ever get in, then we don't need to be worried about it. That's it. Thank you. So lymphedema. So lympha is water in Latin. It is swelling that you can see somewhere in the body, and it's mainly, so our lymph fluid is mainly waste, things that our body's trying to get rid of. And if fluid, so inside us, our fluid needs to be moving round and round and round. We don't want anything to be staying still for too long. When lymph fluid will sit still somewhere, for example, in a breast post radiotherapy, something like that, we run the risk of the tissues changing, so becoming firm or hard, and then that puts us at risk of getting an infection, so a cellulitis, a bacterial skin infection in that part, just because we need to be constantly moving. So again, it is super important to optimize lymphatic drainage of the whole body, but especially in an area where you've had surgery or radiotherapy. Thank you. So obviously, if you've had a cancer diagnosis and they've either removed some or all of that part of the lymphatic drainage, then we can't put lymph nodes back in. We're born with a whole set. Our own lymphatic system is unique to us, so we've all got a different number, and they're all situated in a slightly different bit to us. So often people say, you're giving me this advice to follow. How long do I need to follow this for? And it's hard hitting to say, we can't put them back in. Nor do we want to. They were removed for a reason, but once lymph nodes have been surgically removed or damaged from radiation, we can't fix them, shall we say, but what we can do is optimize the drainage to the deeper part in that area, or teach the body to go around somewhere else. So like, for example, in one armpit, we would try and encourage it to go up into the neck, or to the other armpit, or around the back, or down into the tummy. But like I said, everyone's system is unique, and that's what the research has showed us over the past few years, is that there was quite old school lymphedema schools of like, it has to drain here and it has to drain here, and what the research has shown us is that that's not the case, is we're all doing something a little bit different on the inside, which makes sense. So in terms of, often people say, you're talking to me about this technical term, like what would that mean? And what I would point out at this point is that what's written on this slide in terms of heaviness and fluid and clothing, that might be more acute because you've just had surgery, or you've just had radiation, or you've had chemotherapy. So those things are slightly different to what we would call lymphedema. So for example, with breast surgery, it's very, very common to have a seroma, so like a local collection of fluid. That's not lymphedema, that's just the acute sort of effects of surgery. Likewise, when patients have had radiotherapy, the whole area feels quite swollen and uncomfortable. So again, it's not necessarily a lymphatic drainage issue, it's just that increased demand on the body with that treatment. So these are things that we're talking about that can happen. It can happen acutely post-treatment, but that would normally then settle down. These are things that would maybe more develop progressively over time. So again, as I said, this is looking at from a breast point of view, but when I'm saying things like the arm, it would say the leg. When we say the fingers, we would say the toes. It's genital edema, head and neck, anything really. It's a swelling, and it can come and go. We would say that it tends to be less noticeable first thing in the morning, and then the effect of gravity and movement, often people say, by the end of the day, that limb does feel very heavy. I'm always looking when patients undress about whether there's imprints on both arms. So for example, patient's got a shirt on, you can see the seam on that arm, and you can't on the other side. So that's what we would call like a subclinical sign of swelling. So the numbers, the measurements might not be different, but what we can see on the skin is there's a little bit of fluid sat there. Often people do say they noticed that their rings became tighter, or bracelets, watches, that sort of thing. Next slide, please. So like I say, again, when we talk about subclinical signs of swelling, so again, quite old school way of looking at the lymphatics is saying that you have a 10% difference between left or right arm. So we've all got about up to 5% difference between left or right arm in terms of measuring fluid volume. But when I first started learning about lymphatics a long time ago, they would say, right, a diagnosis of lymphedema would be more than 10% difference between left or right, or more than two parts that's more than 2 centimeters difference in each bit. I even then said, why are we waiting for that? Why are we waiting for there to be quite a difference in that limb? Why aren't we listening to what the body, or thinking about risk factors and almost using prophylactic compression or prophylactic physio to not let it get to that point? So, my view is, I look at everyone as an individual. So if you've had a heck of a lot of treatment in that area. So for example, surgery, full lymph node clearance, radiotherapy, maybe radiation to the chest, armpit, up into the neck, maybe chemotherapy, anything like that. And then someone comes to me and they're young and fit and well and they want to really optimize their drainage, then I use compression with people before swelling is there. I would say, they'd say to me, oh, my arm feels heavy, but it doesn't look any different. Or by the end of the day, I feel like I've got to put my arm in my coat pocket, or it doesn't feel quite right. I listen to that rather than waiting for the numbers to tell me that there's a drainage issue. I think I listen to the whole picture. Some people really want to be preventative, and some people are happy to see how they get on. So it's person dependent and it's lifestyle dependent as well, and dependent on what work role is, home life, hobbies, sports, exercise, doing weights at the gym, that sort of thing. I do encourage my patients to try and use compression when exercising, just because you're going to get the double benefit out of it. You're going to get the exercise, which is going to be that muscle pump, but then you're also going to get the muscle contracting against a compression garment, which is really, really effective. Obviously, weather can play a part, and if you're busy or stressed, that can be when things don't feel great, but then no one feels great when they're busy or stressed. So it's in general that. Next slide, please. So we touched a little bit on there about breast lymphedema, because I think that people sometimes think that lymphedema can only be in a limb, and they're not as sure that you can have it anywhere. So in the face, in the neck, in the breast, like I said, in the abdomen, and the genital edema, lower limb, foot, anywhere can swell. I think that, like I said, I'm looking at it from a breast point of view. We don't want people just to think that breast lymphedema is something that you have to put up with after the treatment. You can really make a big difference by doing some self drainage, by really stretching out, by using little bits of what we call lymph pad in the bra to give it a bit of a massage. There's lots of things that you can do. So what I would want to say from today is, if anyone is struggling with any of this, then do know that it might be tricky to find your way to who you need to, but there is stuff that can be done for lymphedema of any part of the body. So, like we said, the incidence of developing a drainage issue after surgery or radiation is most common. I think it's about 80% chance of it happening within the first 2 years, if it's going to happen. But I do see people that go years and years and years of having no issues, and then all of a sudden, what I have seen after the pandemic is some people developing a drainage issue just through lifestyle change through COVID, through the pandemic. So people that would have quite an active lifestyle, would be going out every day, would be walking every day, maybe looking after children, grandchildren, going to work, and then stayed in and got lymphedema. And there was no injury, no infection. It was just the lack of movement. So that even further reiterates what we say about the importance of movement. And if we keep the whole body moving, then we're optimizing the lymphatic drainage of the entire body. In my experience clinically, the main issue that people have of developing a lymphedema is an infection. So a bad infection in either anywhere local to that drainage area, because it puts too much pressure on a system that's already working a little bit harder. So we'll go back to that when we talk about prevention, because really the biggest, well, other than exercise, the biggest thing you can do is moisturize your skin, moisturize that local area, because moisturized skin is 3 times as strong. So it will stay strong. It's your skin is your layer of defense. So if your skin stays intact, the infection can't get in. So that is really, really, really important. Next one, please. So yes, like we said, that it does come to a shock to some people that we can't put a time frame on this. So I think that it's hard enough, isn't it, to have a diagnosis, to go through this treatment, and for them somebody to say to you, oh, well, this could happen at any time, at any point. It's not something that we take lightly. But what we want to empower people is to say, yes, the risk is there, we can't change that, but what we can do is lots and lots of prevention and lots of management if we do need to do it. But I think it's much better for people to be aware of this, so that they can do something about it, rather than leave it. The number of times you hear people say, I didn't want to bother you, but that's, that this is what people's jobs are. People's jobs are to help you with this, so you're not bothering anyone. It's what everyone's here for. So, any concerns at all, you utilize your local specialist team. And again, often people find it hard to hear that if they've we can't sometimes resolve it entirely. So for most people, we can really get it very manageable, maintained really well, but that does take some effort. So I think it's getting your head around that it's not maybe something that you do as a one-off. The exercise and the skincare and potentially the compression or the manual drainage is something that maybe might be long-term and might have to be adapted as part of life. And it takes a good therapeutic alliance with whoever's treating you to really get you on board with that, because sometimes I see people and they do really well, but then almost become a little bit resentful to having to do this and continue with this. So it's really important to understand why you're doing this and the benefits of it, to do it properly, and then to see the results, really. Thank you. So yes, so cellulitis. I talked a little bit then about bacterial skin infections. So as I said, fluid inside us should be moving around all the time. So we're constantly moving this fluid around. If we're always moving, then we're always draining, and fluid is never going to sit anywhere. So if fluid sits, so if lymph fluid especially sits and collects somewhere and doesn't budge, we do run the risk of cellulitis. So post-treatment or during treatment, at any point, if you've had surgical removal or radiotherapy and an area in that local area starts to look inflamed, red, rash, swollen, then it is really important that you get some antibiotic, seeing a doctor and you get some antibiotics started, okay? Because what we've talked about is that the slightly impaired ability of that lymphatic system to respond to infection. So we know that recurrent infections in the same bit over time repeatedly will damage the remaining lymphatics. So we take great care in, if there is any sign of infection in that area, of getting antibiotics quickly, promptly, getting them started. I have conversations with patients a lot about having a course of antibiotics to keep at home. So if it's over the weekend, it will always be the weekend or a bank holiday, because that's just what happens. You are not sure, you think it's red, you're not too sure, what do I do? My advice is to start them, because we'd rather run that risk than need to be, acutely stepping it up to IV antibiotics and either having them at home or when you're on holiday. The last thing we want is for you to be on holiday having a great time, get an infected insect bite, and then be in a situation where you become acutely unwell. So it's just having that conversation with your GP. There is a really great document called the Consensus Guidelines for the Management of Cellulitis in Lymphoedema, which can help to be used to inform other healthcare professionals about the need to have these antibiotics just in case. It does state that it's to do if you've already been diagnosed with a lymphatic drainage issue, but I use it with my patients that are at risk. So I say, right, they've not got this, but it could happen if we got a bad infection, we didn't get it treated. So I just like people to be informed, and then you can make their own decisions. That's it. Thank you. So 4 cornerstones of treatment. So that, like we've talked about exercise a lot, and I'll go through some stretches in a bit. But I think that for me, that the biggest thing I do with my patients when we're talking about lymphatics is to stretch that local area. So we know that scar tissue is tight and is sticky. And then if it's been irradiated, it's going to get even more sticky and it's going to get even more tight. So for a lot of people, just doing the right stretches and holding them and getting them deep enough can be enough to really optimize that lymphatic drainage. Because I think people think, oh, I've had my lymph nodes removed, now this is how it has to be. But then we do some really good stretches and hands-on treatment, and it gets better, because it's not necessarily the surgical removal of the lymph nodes, it's the scar tissue blocking that drainage from being able to get to where it needs to get to. So exercise in general, super important, but specific stretching exercise for that area. So the bit that's had surgery or radiotherapy is absolutely crucial. Like I say, the second most important thing would be skincare. So I just try and, encourage my patients to just get into that daily routine every single day, morning and night, moisturizing that bit of the body, keeping it tough, keeping it strong. And then it's also, you're getting a bit of a lymphatic drainage by rubbing your cream in as well. So it's win-win. Compression, we've touched on that a little bit. Obviously, if we needed a compression garment, we would need to get that from somebody who's a lymphedema practitioner. But yeah, it can be, it's not the be all and end all. I think often people think that that's the only thing that you can do. It's a part of exercise, of management, but it's not all about that. I get people to stretch before I put them in compression, because if it's a tightness issue, putting a compression on is not going to unstick that scar, so it's not going to have anywhere to go. So it's important at looking at it from all those angles. And again, massage, like manual lymphatic drainage, again, can be utilized by a specialist practitioner if necessary. But again, it's not the be all and end all, because movement is going to pump those exercises way more than somebody massaging that limb. So the exercise is super, super important. Next slide, please. So skincare, the main thing we talk about is that regularity of that moisturizing. I think that for some people, because of COVID and gelling your hands in and out of shops all the time, a lot of people got like a dermatitis, like in the hands, which causes problems with the lymphatics. That if we get really dry, irritated skin in the hand, it's going to cause us bother, because it's going to put additional pressure on the lymphatics. It's going to put us at risk of infection. So I say to everyone, obviously, if you're using your Alka-Gel a lot, then just make sure then you put your moisturizer on straight after. I say to people, get into the routine of when you're washing your hands, have your hand cream next to it. It's just new routines, really, just introducing them and then sticking with them. Insect bites, clean and covered, in the sun, try not to get sunburn. If you're shaving in that area, just be a bit mindful of taking a bit of extra care. I think especially post breast cancer, people are very fearful of hair removal up in that armpit. I say that it's a case of, you might be quite numb up there, and the shape, that concave shape of that armpit, might not be the same anymore. So it's just watching what you're doing and taking care. Gloves when you're doing the dishes, gloves in the garden, blah blah blah. We've all seen all of that. But it does, if there is it does make sense to reduce risk with things like that, because a number of women I see come in and they've badly burned their wrist from reaching in and out of the oven repeatedly, and you think it is something that can be avoided. It's just when we're busy and trying to get everything done, I say, right, okay, well, if we can't stop that burn, then we get a plaster on it after it's happened. I'll take whatever I can get. Next one, please. One thing I would like to mention in terms of skincare, which is something that we do have an evidence base for, is, if possible, having your blood pressure taken on the opposite limb. So if it's an arm, then the other arm. That is because some research was done looking at, so basically the latest thing in the world of lymphatics is infrared fluoroscopy. So basically what that is injecting an infrared dye into someone and into the lymphatics, and then using an infrared camera shining on it to see what happens. And that's where all this work's come through, looking at the fact that everyone thought everything was very rigid in terms of drainage, but actually some people drain up one leg and back down the other, some drain up to the neck, some go through the hand. It's everyone does something different, which is great. But when we're thinking about blood pressure, what they did was look at the superficial lymphatics in the top of the arm and the pressure that would be required to shut them down, and then the pressure that a blood pressure cuff goes to, because it goes very tight, doesn't it, in that local area. And the pressure that the blood pressure cuff goes to is about double what we would think would take to sort of shut down some of those superficial lymphatics in that area. So I do strongly would suggest you to avoid having repeated blood pressure on that arm if possible. When it comes to things like injections and surgery and things like that, that's a little bit different, because a lot of people have had chemotherapy. So you say, right, don't use the arm where you've had lymph nodes out, but if all your chemo has been given in the other arm, then there's no chance anyone's going to be able to take blood out of that. So it's about risk assessing there's somebody as an individual, I say, right, if possible, we will utilize the other arm for things like bloods and injections. But if we have to use that arm, we have to use it. But we stretch and we skincare and we do all the other bits to protect it. What I would say to you is, don't automatically assume that whoever you're going to see that day knows that you've had the treatment on that side. You know, you do have to, you know, when you go in, we've all been having jabs and stuff, haven't we? So everyone goes, which arm do you want? You know, do try and make sure that you say, I would like this other arm if possible. Don't assume that they know that you've had your treatment in that area, because they may, but they might not. So it's important just to say, I would like it on this other side, please. And all they need to do is move all their stuff around to the other side. So in terms of damaging the skin, all I would say is, I say to people, you know, have your gel in your hand, have your moisturizer in your bag, but carry plasters around, carry some antiseptic cream in your bag. So these things will always happen when you don't want them to happen. You know, that a cut will always happen when you're somewhere really dirty, or, you know, you can't get it clean straight away. So it's just being organized, I think, isn't it? And thinking, right, okay, if I'm worried about infection, don't think I'm not going to bother anyone. Do bother people. The number of GPs that I have to ring and say, I'm either sending the patient to you or to A&E. What are we doing? I don't want to send patients to A&E for antibiotics in any way, shape, or form, but you do need antibiotics. So we either you know, it sometimes, you know, it does need to, we do need to sort of utilize the risk assessment in terms of, I've had this treatment done, I do need to have these quickly. And like I said, having that conversation with the GP potentially about having a course of what we would call just in case antibiotics to have at home with you, just in case. Thank you. So exercise, I'm not going to go into exercise loads, because I think that we all know how important exercise is. You know, it's common knowledge that, you know, exercise is going to really help after a cancer diagnosis in terms of, you know, general well-being and mind, and mental well-being as well. But it will have a massive impact on lymphatic drainage. And you know, I don't want you to sit here thinking, oh, she doesn't know what I've gone through. I've had chemo. I feel like, you know, rubbish. I'm not saying, I understand that, you know, exercise may come at different times for people. So I don't want anybody coming away from this putting loads of pressure on themselves to be going out and doing loads of exercise. But what I would say is, don't be afraid of exercising. You know, I think sometimes, you know, well-meaning family and friends say, should you be doing that? Should you be doing that? Should you be doing that? And, you know, are very want to wrap you up in cotton wool. So what I would hope that you would take away from today is that there is no exercise that's contraindicated with any type of cancer surgery. Obviously, it's all within reason. It's all independently individualized, you know, bespoke to that person. But starting something small and gradually building it up, you know, that is going to be massively beneficial. And often I have family and friends ringing me going, have you is it okay that they're doing that? I'm like, yes it is. So like I said, super important. I used to say, so I've been a breast cancer physio for about 12 years. So literally 10 years ago, I used to say to people, before all the evidence came out about exercise, I used to say, right, you've turned up for that chemo every day, you've turned up for that radiotherapy, you've turned up for that surgery, you take that tablet, make exercise as important as those things. So you would never not turn up for a treatment or for an appointment or not take your tablets. Make it as important as that, because it really is. Like, that's the evidence that's coming through, is that it has a really big impact on recurrence rate. So it is super important. But I understand that it comes at different times for everyone, and it isn't, you know, going to be the priority when you're feeling very poorly from some of the other, you know, some of the treatments. So it's about when it feels right for you. Okay, thank you. And again, I'm not going to go into this too much, but it's basically just about how much we should all be doing. 150 minutes of moderate exercise. I think everyone knows that post-COVID, and everyone was walking and exercising, you know, after it, because we realised that it does do a lot for us, and it is just good to get out in the fresh air, isn't it, in terms of vitamin D and things like that. But I think I did the menopause talk last night with the doctor, did that, and I think it was really good that he pointed out about exercise, that when talk about weight bearing exercise, I think people think it's all got to be weightlifting, like we've all got to be like lifting these really CrossFit type exercise. It's just loading the joints at all. So walking is really great. Anything that loads through the hips and the knees and the lower back is, you know, obviously if you want to do weights, cool, that's great, but if you just want to go for a walk, that's also great. Thank you. And yeah, again, it's just to acknowledge the effects of, with chemotherapy, especially, coming down and up off the ground, doing things that probably came pretty easy before are much more challenging. And it's, thinking what you've got in your local area. I mean, here at Salford, we're really lucky that we've got a charity called Can Move, which anyone that lives in Salford that has any diagnosis of cancer can utilise, and it's a free gym membership. You meet up with one of the trainers; they're really lovely. They go through a program with you. You can go to the gym yourself. You can go to classes. You can use a pool for 2 months for free, just to try and get that confidence back of getting back into that sort of exercise regime. I say to my patients, I go to the gym and I'm nervous of going into the bit where the men are all there with the weights and stuff. I feel like I don't know what I'm doing, and I'm a physio, so I get it. It's intimidating, and you feel like everyone's looking at you, but really, hand on heart, they aren't. No one else. Everyone's doing their own thing, or like taking pictures of themselves, or like what they're wearing and their hair. So don't worry about it. Just do what's right for you, and don't worry about it. Don't worry about anything else, really. Next one, please. Yeah, next one. That's all just the blurb of what, and again, kind of exercise, we know that just movement is key, and I think everyone's understands that doesn't have to come in one form. It can be cleaning your house, it can be taking the stairs at work and parking a little bit further away, it can be moving around when you're on the phone or when you're in the kitchen, just anything that moves the body, going up and down the stairs a little bit more often, and I think the exercise thing with working from home is a big thing, because I noticed that I did 1 day a week for a while, and my step count, I was literally like 100 steps in a day. And I was like, what's going on? I thought my watch had broken. So it's just actually just going about your daily business does get you quite a few steps. But using a step count, monitoring that. Everyone's got fancy phones these days where you can do all that sort of stuff. But it does encourage you to sort of beat your personal targets or get that number of steps in a day. Or if you're like my husband, just wave your arm around pretending that you're walking and getting your steps up when actually just waving your arm around. So but do make sure that you actually do the exercise. Next one, please. So as I think I've covered this really, but in terms of exercise and the lymphatics, is that basically nothing happens to the lymphatic system unless we move. So really it is as simple as that. If we sit still, we're not draining. When we move, we are draining. Deep breathing, yoga type exercise, Pilates are very good, because the deep breath utilizes the lymphatics deep inside us in around the thoracic spine. So deep, anything that incorporates some nice deep breaths is really, really good. Swimming is great. Often patients are a little bit nervous to swimming after like breast radiotherapy in particular, but I would say that once the skin reaction's gone down, swimming is really, really nice, because as the arms flow through the water, you're getting that lovely lymphatic drainage. Again, often people have got some reservations with swimming if they've had surgery or anything like that, where the body looks different now. But it's important to say that out loud, and then we can look at what's available. We can try and make things as good as they can. But again, it's like being in the gym. I think people think that everyone's looking at them, but actually everyone is doing their own thing. It's about just prioritizing what's important. And I've got some patients that will send me pictures of them about to go in the pool because they're just so excited that they've got the confidence to do it. And I'm like, do it. Yeah, so yoga, Pilates, that type of exercise. But any exercise. There was Hannah, Shine Hannah, she sent a message through before. There was a message that came through about somebody that said that they'd had 6 lymph nodes removed, and what kind of exercise should they do in particular with weight training. There is no hard and fast rules. When you feel up to it, you gradually build your reps up, gradually build your weights up, but there's no restrictions. It's just about gradually building back up to anything. If you then did start doing stuff that you was able to do before and it didn't feel right, that's when you ask for some help with it, because we want you to get back doing exercise that you did before and more if possible. Thank you. So these are obviously specific for post breast surgery or radiotherapy, but in essence, the theme is just stretch that area. So wherever the surgery's happened or the radiation has happened, stretch that bit out. These 3 I would encourage anybody to do, because I think that they're just really, really good at stretching the upper back out, the armpit, the chest, and they just make you feel better. So you lie down as flat as you can, and you basically, the first one, you just hold your hands, clasp your hands together, and you just stretch over your head as far as you can and hold it for a while, a good 20 seconds, really stretching that chest out. And the second one is you start with your hands down by your sides and you just make a big circle all the way up to your ears. And then the third one is just, again, on your back, hands behind your head, letting those elbows fall out. And then if you want to increase that, you bend your knees up and you just gently take the knees side to side. If anyone wants to talk through those exercises anymore, then, just let me know. I'm going fast so I can answer some questions. But stretching is key. So literally, if you've had a groin dissection, you tighten your hip, stretching the hip out. If you've had a neck dissection, stretching that neck out. Wherever the surgery has been, it's about stretching that area, and it's about deeply stretching as well. So not just racing through the exercises, doing loads of them, but not holding it. Much rather you just did a handful of stretches, but did a lovely long hold. So you're getting deeper, because radiation especially goes deep. So we have to hold the stretches to be able to affect that. Next one, please. So this one is a little bit about weight management. Obviously, again, everyone knows that we're supposed to be a healthy weight, and often people put on a lot of weight with cancer treatment. It's what I see day in, day out. That frustration of putting on weight and then struggling to lose weight after treatment. So again, I don't want you to think you're sitting, she ain't got who we're talking about. Like, I'm just telling you what the advice is, but I am fully aware that it's not as easy as that. And us as healthcare professionals are here to try and support you to be as healthy as possible. But in essence, with the lymphatic system, it's like I said, we've all got this unique drainage system. So you imagine on the inside of us, we've got this network of pathways of fluid drainage that's designed to cover a surface area of us, of a healthy BMI. So either being overweight just means that we've not got enough drainage for the size of surface that we have. So it is we are more at risk of a drainage issue developing. And also, if you've got a lot of fat in a limb, it's harder for the lymphatics to get past it, in essence. So it is pretty basic in terms of the fact that it will make the risk of developing drainage issue a little bit more, and it will make it a little bit harder to manage. But again, I'm fully aware it's not as simple as that, but it's part of the evidence base. So in terms of what we do, I was just saying to Emma before the session that obviously I don't know the ins and outs of the referral pathways for every different area. So unfortunately, I won't be able to answer specific questions about, I know I live here, what's available. I wouldn't know the answer to that. But what I would encourage you to do is utilize your specialist cancer team. So you should have a specialist nurse. If you don't, then you use the secretary, surgeon's number, whatever, and you ask for either a lymphedema practitioner or a lymphedema physio or lymphedema nurse, whatever, and get assessed and get the treatment, because there will be a service in your area. Whether that person knows about it or not, that might not be the case, but they need to look into it, because you're not going to be the only person asking that question. So sometimes lymphedema services sit within physio, like what I've set up in Salford. Sometimes they sit in the surgical centre, sometimes they sit in the local hospice, sometimes they sit in GP practices. It is different everywhere, and there is a lot of variation, unfortunately, between areas. There is quite a lot of private practitioners also. Kendall Lymphology, Jane Wigg in Stafford. There is some places that you can pay if you've got concerns and you want to access treatment quickly. So yeah, it is all, unfortunately, there is a bit of postcode variation, but it's like with everything, isn't it? But I would just say, don't settle for thinking, if someone goes, oh, I don't know, don't settle for that. Keep asking. Thank you. So like I say, again, this is about specialist nurses, physios, GPs. I would suggest that you do try and utilize your specialist team. I would say that is, in my experience, the easiest route. Going to the GP, they are less likely to know about the specific services to do with your cancer treatment. Obviously, you might have a GP that knows all about that, but again, it will just vary, in your area. So I would always start with your specialist nurse and then move along from there. And breathe.
Fantastic. Thank you so much, Karen. I was like, as you were going through that, I was like, oh, I might ask about that. Oh, I might ask about that. And so hopefully, if like everyone appreciated that. I think there was so much information there that
sorry, I went really fast, but I was like, I've got this time and I want to tell everyone everything.
Of course, yeah. I mean, if anyone's got questions, feel free to put them in the chat, or you can unmute and show us yourself and ask Karen a question. Tanya's saying that's great. She's made loads of notes. Oh, actually, that's a good point. Maybe I should have told you this at the beginning, but Karen did say we can share the slides. So we'll get those uploaded to the conference platform. If you can't find them on there, just drop me an email at any point and I can send them directly. But yeah, there was so much. I mean, actually, I was talking to Karen about this earlier, but I had lymphedema following my own breast cancer treatment, you know, all those years ago now. And my lymphedema is really well managed, and it's pretty much kind of, my arm's pretty much the same as the other one, the good one. Is it that good arm and the bad arm? Can we say that? Now, but
I don't like it to be called naughty arm and good arm. Affected.
Oh, okay. It's amazing how much things change, because I remember 15 years ago, you know, they were only just then saying that exercise was a good thing, because you know, and they were saying, oh, well, everyone else says you can't do exercise, but I think you can.
Yeah.
And you know, so it's really great that it's kind of moved on, because that is what helped reduce mine, definitely. So
and I
yeah.
think the evidence based with lymphedema is limited, because I remember when I went to do some training and they explained it to me, and I thought that is a good reason, to be fair. So you know, to prove about why lymphedema happens, I think the latest study was in like the 1960s, because ethically there might be this potential, oh, maybe doing lifting weights might give us a drainage issue, because there's any risk of ever giving ethically anyone any harm. Nobody can prove or disprove. It's really hard, because we can't do any trials, because we can't run it. Like, I did a master's in research and I just talked to people, and the ethical approval that I had to go through, that I wasn't going to cause people emotional distress, I was like, no wonder it's really hard to do these clinical trials, because I'm appreciative, like ethically we, you know, it's very important, but equally we're in a bit of a sticky situation, because we're giving out information, well, people used to give out information without the evidence base behind it. And so I've only become much more confident in giving out the exercise information just because of my own experience for doing it for 12 years and seeing the results. You know, we've not got the evidence base behind, but it's like you said, Emma, like, you exercise and it gets better, so it works.
Absolutely, yeah.
You should do a research trial yourself.
On myself.
Yeah.
Tanya, did you have a question? Did you want to?
Yeah, I was just thinking, I'm meeting with my surgeon in a couple of weeks, because my next step will be surgery. And I was thinking what I might actually do, rather than wait till after the surgery, I might ask then if there is a lymphedema practitioner, physio, etc., you know, before the surgery, so I'm being a bit more proactive.
I think that's absolutely great, because it's good to really have, I always describe us to patients as a bit of a safety net. Like, hopefully you might not need to use this, but it is really good, because, you know, when you've just had your surgery, the last thing you want to do is like be ringing around and everything. Like, the gold standard in terms of the world of lymphatics is to have, now this doesn't happen, so I'm just saying, we used to do this 10 years ago when we had the surgical centre at Salford, but the gold standard is to have baseline measurements, so that you then know if your arms change, because everyone's arms are a little bit different, like I said, up to about 5% different. So 10 years ago, if you got diagnosed where I work, we would bring you in pre-surgery, take your limb volume measurements, and then have a baseline to compare against. Now, that doesn't happen anymore. It's not, but that is the you know, the gold standard. But yeah, just knowing what advice you're going to get after. A lot of places do a lot of surgical centres do physio advice post-surgery, plus some lymphatic information as well. But what I would want to know in my local area is, right, if I've got a drainage issue, who would I see? What would the weight be? What's the referral process? Because waits for things are long. So, you know, as I said to you, like, I'm all about prevention. I don't want people to sit on waiting lists and things progress when we know that we could, you know, have an impact.
Yeah, thank you. Yeah, I'll do that.
Excellent. Let us know how you get on. It'd be interesting, because I think Karen and I were talking about you know, sometimes it's a bit of a postcode lottery, like whether your services are well staffed or whether they're easy to find. And you know, like where I am, there's a specific lymphedema clinic based in the hospice, which is brilliant. But I mean, no one told me about it for a few years, so it took a little while to find it. Raf's got a question, Karen. She's saying, could you elaborate a bit more on why you shouldn't have acupuncture on the affected area? And just for reference, she had abdominal lymph nodes removed, so whether that makes a difference.
Yeah, so I mean, you can still have acupuncture after, but a lot of acupuncturists wouldn't put the needles in the, like, for example, if you'd, so in that case, in the limb that would be affected by that lymphatic drainage. It depends what you're looking at it, because acupuncture is either traditional Chinese or Western. So the Chinese approach is that you're putting the needle in and you're manipulating it to create a chi. So it's like the flow of energy. So that might be a reason. I don't perform acupuncture anymore, but I personally wouldn't acupuncture that limb. Mainly, I think, because it's the slight risk of, breaking that skin, creating an inflammatory response in that area. We don't know exactly how it would react. Years ago, when I did do acupuncture, if somebody needed it, I would just not do the points on that bit. But there's lots of points everywhere else that you can utilize, like a pain point you could do in either hand. There's lots of points in the head, lots in the back. So I think it's just being with maybe a practitioner that would maybe go somewhere else. I think there might be some people that would acupuncture that limb, but I would imagine there's a lot that wouldn't, just because of the risk. And again, there won't be an evidence-based to prove or disprove whether acupuncture gives you it, because we can't do a trial. So it is tricky. In essence, it would really, for me, only be a risk of an infection, which should be very rare from a needle. But again, it is so the therapist doing it would be so subjective to the depth of what they use, what needle they use, where they put it in, how much they manipulated it. There's a lot of variables, but I wouldn't not encourage people to have acupuncture. I would just say, have them everywhere else.
Yeah. Excellent. Oh, Raf says, thank you. That's clear. Thanks very much for the explanation.
I used a lot of words. I don't think it was that clear.
I think it's interesting, isn't it? I remember, I'd have to look it up. I don't know where I read it now, but I remember reading that they'd not done a trial on acupuncture and lymphedema, but it was about measuring the response to an acupuncture needle compared to the response to like a big old proper needle. I'm doing that because I've just had my booster, and it feels like that.
On the other arm, on
that arm, yeah, absolutely. But yeah, there's I can't remember the study now. I'd have to look that up, but it was, saying that, interestingly, like the response, because the body doesn't know that it's just a needle and not something that's going to,
exactly, yeah. So it's that sort of immune response. You don't know what it would create in terms of reaction, because the lymphatic system is already working that little bit harder. So any break in the skin, it might think, infection, and and it panic the system. We don't know. The honest answer is we don't know, but I wouldn't be put off having it. I would just use other points.
Yeah. If anyone else has got any questions, feel free to put them in the chat. I think I had one about flying and prevention, or if you're already managing like lymphedema in a limb. Then I know that some people have been told to wear compression sleeves or compression socks, or I can't remember what they're called when they go up your whole leg, when flying. Is that something that's still
so I would say with the flight, it is actually the most important thing I would say is keeping moving, because if you already had so I wouldn't give someone a compression stocking just for flying, because I would imagine that the movement and getting up and moving, doing exercises regularly during that flight would be more beneficial in terms of lymphatic drainage. However, if you had a compression garment that you'd been prescribed, I would suggest to wear it for the flight and for a bit after, because we know that it fits you well. My issue is about self-buying compression, especially lower limb, is that actually a bad fitting garment will cause you much more issue than not having one on. Because if you sat down and it's digging in the back of that knee, that's where all the lymph nodes are. So it will probably make it worse. So actually movement and keeping moving, so doing those circulatory exercises, on the hour, every hour, getting up, walking, that would be my personal preference. But like I said, if you've got a well-fitted garment that you've been prescribed, yes, I would wear it, because flying and warm weather will flare, but we all swell, like that. The whole body swells, doesn't it? But lots of not drinking too much alcohol and drinking plenty of water and keeping moving, that would be the advice that I would say for flying.
Oh, and the other thing that popped into my mind when you were talking about keeping moving and not having to be, 7 days a week at the gym, was we work with an exercise after cancer specialist. We've worked with him for years, and the favorite thing that he does, that he talks to people about, is for me is he's talking about when you're doing normal things like the housework, that you put a bit of music on and you put an extra stretch in it. So if you're doing the dusting
or stretch,
you're kind of doing a bit of, you've got a bit of staying alive going on and like doing the dancing while you're dusting. It just made me think about that, about doing a bit more.
I think every bit of exercise is key, isn't it? We know that it's the cumulative effect of it. So a little bit of movement, but a little bit often is just as good as going and spend, that's what the research shows, isn't it? Like really sedentary lifestyle, but then doing loads of exercise. It's actually better to do little and often during the day, isn't it? So I think a lot of people lose a lot, understandably, naturally lose confidence after treatment. And it's just one of the things where you think, oh, someone's telling me what to do, But it is so helpful, and it just makes people feel so much better. It just, confidence comes back, and empowerment, and thinking my body can do this. But that will take time. Everyone's different. That will take time.
Absolutely. Does anybody have any other questions before we finish up? I have got one more, but I feel like I'm asking all the questions.
I told you it was just me and you chatting. I said that.
And I've got another one, because I was just thinking about some other advice that I'd been given before about being careful when you get manicures and pedicures. About how sometimes you get, I don't go for manicures very often, but sometimes you go to some that seem particularly violent. Whether
you don't lean into the sides. I remember I had one once and it did make my finger bleed. So no, I think that's a really valid point. It is anything that's going to potentially cause trauma to that limb. It is worthwhile considering, definitely. That was a long time ago when that happened. So maybe the people are just better at not hurting. I don't know.
Yeah.
I haven't been for such a long time. That wouldn't be.
That probably put me off. Anyway, so yeah, okay. We are coming up. This hour has gone so fast. I think all of the sessions are doing that. I think actually, while we've been talking about exercise, if that is the topic, we do have a session. I'm pretty sure it's tomorrow evening about exercise, but have another look at the agenda if there's if you wanted to look at that as a separate session. But don't go anywhere yet, everyone, because if you've been to any Connect sessions, I'm going to ask you to answer a poll. So I'm just going to open that poll so that you can do that. But just really thank you so much for joining us, and a massive thank you to Karen for your time and for the presentation. That was really informative, and although I've been dealing with lymphedema for kind of 15 years, I still managed to learn things in that one. So it was amazing.
It's about listening to patients and learning what works for people, I think, isn't it? And being open-minded with people. When I used to do training, there was a lot of talk about non-compliance. Patient is non-compliant. But why? Why are they non-compliant? Why? Think about it. If they're not doing that, why are they not doing that? If they're not wearing that, why? So it's our job to make people want to do it, rather than think it's one extra thing to think about, incorporating it to everyday life, and then
absolutely, and explaining it as well, I think, isn't it? Because sometimes you're told to do something, nobody likes to be told what to do they? We like to understand why we might want to choose to do it, but yeah, so I think that makes a big difference, doesn't it, as well?
I think that's the main thing that I would say, is that stretching that area will have such a massive impact. I think people maybe aren't as aware of that after the radiation, that just the movement in that area will restart things draining. I think often people think, well, I need a compression, straight away I need to compress, which is obviously part of it, but if we don't unblock that area, if we don't get things moving, it's got nowhere to go anyway. So it's important.
Fantastic. Okay, brilliant. And on that note, I will upload the slides to the conference platform, but if you need them any faster, or if you can't find them there, then just drop me an email. I'm emma@shinecancersupport.org. Thank you very much for your time, everyone. And I hope we'll see you at another session.
Thanks.
Bye.
Bye.